So we have this question of acute glomerulonephritis, where the question is, in acute glomerulonephritis, which of the following may be absent? Options are pulmonary edema, periorbital edema, peripheral edema, and concentrated urine. So answer is peripheral edema. Now we have to understand why this is the answer. Now see, whenever there is a glomerulonephritis, what happens? Whenever there is a glomerulonephritis, there is injury to the glomeruli, because of which there is decreased GFR and there is increased RAS activation. Renin, angiotensin, aldosterone system is activated, aldosterone increases, and so there is sodium and water retention. And when there is sodium and water retention, it leads to the hypertension and concentrated urine, because most of the water are initially absorbed. Therefore, patient initially shows anuria, or he can also show oliguria. Oliguria is less than 400 ml urine in 24 hours according to the Harrison. Now, so this is what happens. So whenever there is hypertension and concentration and there is concentrated urine. Now, see, if this is your alveoli, what happened? The capillaries around the alveoli are very numerous. They are very numerous in number. Very numerous. Secondly, they are very thin. The wall is very thin. Secondly, they are made for their low pressure system. That is, generally they operate in 8 to 10 mm of Hg, and when there is hypertension and increased pressure, they become leaky and suddenly fluid start coming out from them, and that lead to the pulmonary edema. That is why even a slight hypertension and slight hypervolemia leads to the pulmonary edema. This is true in all the cases. Even when you see flash pulmonary edema in hypertensive emergency, the exact reason is this, because they are numerous, thin, and meant for low pressure. Now, why there is periorbital edema? The reason for the periorbital edema is because the periorbit skin is very loose, even if you can raise your skin. So that is why there is this edema. So this is the reason why this patient has pulmonary edema and there is periorbital edema. Now coming to the thus what will be the symptom? There will be pulmonary edema, so there will be increased blood pressure, increased hydrostatic pressure, leaking of fluid into the alveoli, and dyspnea on exertion, and orthopnea. That is dyspnea during lying down, which is relieved when patient is get-ups. And what happens in periorbital edema? There will be puffy eyes, and there is no peripheral edema. Initially there is no peripheral edema, but afterwards, even if it is not treated, peripheral edema can also be present, because please remember, peripheral edema is time dependent, and a particular pressure is required for it to be formed. So it is not formed initially.